I don't normally look like this. I really dressed up for you guys this morning, but it meant that I showed up in the ICU because I had to round on my patients a little bit earlier, and I scared the medical residents and the nurses. One of the nurses who I've worked with since earlier last century pointed out, "You've never ever worn a suit. What's going on?" So I don't mean to scare you through this talk, but rather maybe convince you that we have a real opportunity to do something exciting over the next little while related to healthy aging. Okay, we'll try and figure out how to change that. I'm the director of the Center for Heart-Lung Innovation. Our little logo is up in the corner there on the slide. And we do a lot of basic research, but in fact, members of our group are very translational. I'll use the word translation quite a bit over this talk, and I want to talk to you about that and how I think that's a really important path forward for us putting together something like a Healthy Aging Institute. And so the question is, can our little heart-lung group help spin off healthy aging? Well, we're not that little, and we've actually done this a lot. We've spun off a lot of important centers, including, very surprisingly, Center for Excellence in HIV/AIDS. Remember, AIDS started off back in the 80s largely as a lung disease, and that's what we were doing at that time. The director of the CFE HIV/AIDS, Julio Montaner, actually was a postdoc with Jim Hogg, who founded the HLI. But also Peter Perry helped really establish, and Jim Russell helped establish CHAOS. We've spun off the Center for Institute for Heart and Lung Health and Proof. But in the biotech sphere, we've actually done a lot, and just in the last couple of years, we've certainly spun off more companies than this. But in the last couple of years, there's a bunch of biotech companies that we've spun off, starting with discoveries in a basic science lab. So how is that done? Well, the whole idea is its translation from basic science discovery, which is over there on the left-hand side, that left-hand blue mountain. But we want to take that basic science discovery and actually improve care. So that's the very far right-hand mountain. Now, the CIHR, Canadian Institutes of Health Research, say there are two real problem valleys in getting from kind of point A to point B, discovery to actually improving healthcare. The first one is T1 translation, second one, T2 translation. The T1 translation is going from our basic science lab discovery and getting something kind of first in human. Can we actually develop a treatment? And then the Valley 2 there is more like what CHAOS and others do, where they take a clinical trial that shows that the drug or therapy works and actually get patients treated with that, get doctors to use that. That's a huge challenge. That's called knowledge translation, and those guys are experts. We support them all the way. But what I'm going to talk about today is that we could help out in this T1 translation sphere. And we're not the only ones who think this is exciting. So in Science, just in September, they point out Scripps, which is, we all know is a real basic science lab. They're investing like $1 billion into the idea of moving this on T1 translation. They don't want to just make a whole bunch of discoveries anymore. They want to do something with it. That's the T1 translation step. And how could that help out our patients? Well, Victor, who you heard about, is living with Chronic Airways Disease, COPD. And we're a heart-lung research center. And some of our scientists know a lot about the basic mechanisms underlying COPD. And more recently, what they did is they took really a kind of cool scientific approach. They took lung tissue from patients with COPD, looked at what every single one of their genes was doing, 25,000 genes, and they got a pattern of activity of these genes. And then what they did is they got a library of tens of thousands of different chemicals and found out which chemicals did the photonegative, the exact opposite. And they surmised, well, if the drug does this and COPD does that, hey, maybe it kind of evens out. Maybe this is a treatment. So they used, this crazy red and blue and black gene expression approach And the drug that they found was in skin cream. So, hey, someone's figured this out before too. This is important in healthy aging. But can they get that to Victor? Can he be treated with this? Well, no, until you do the T1 translation step. You have to take the basic science discovery and get it into the first clinical trial. So that's what we're working on. So what are the components of T1 translation that are essential? First, you have to have the patient need. That was Victor and his COPD. You need a basic science lab to make the necessary discoveries, but you need patient data to validate whether this works out. You need real capacity to look at all of the data that you're generating. And these days you saw those 25,000 genes and differences in expression. So this is a huge step, but key features that are absolutely essential is you have to protect the intellectual property, otherwise no one's going to invest in this and commercialize it. You have to have an iterative development process because the first drug you discover probably needs some modifications, and something like CDRD with UBC are folks that we work at this point. You need early commercialization steps, and those are really tough, and it's partners outside of our lab that we've hunted down, and we found fantastic folks to work with to help us through those commercialization steps. But a key feature that's absolutely missing is we don't have a first-in-man facility, yet we sit in a hospital. I work in an intensive care unit where we have all of the capacity to do that. So what do we have? Well, we have the Center for Heart-Lung Innovation. This is a T1 translation lab, a basic science lab. 250 people work there. That's a lot of intellectual capital. It's 50,000 square feet of wet lab, dry lab, $10 million a year in operating funds, and 200 publications a year, so tons and tons of discovery. We have the data from our patients, data and tissue registry, 120,000 tissue and blood samples and huge databases that accompany that. We're sitting right inside of a hospital that has a busy heart-lung center, so we've got lots of problems to address. We've got some IT support, not what we need, and we have, for nascent data analytics, but truthfully, all those T1 translation steps, we've been doing ad hoc. Truly, we kind of just bump into people and ask for help, and that's not a really great way to make this all work. So we've got that part of it, we've got mountains of data. What we need, I think, is a high-capacity computational hub, and we're developing that. But more importantly, right now in this time where we're converting St. Paul's Hospital from that mud shack into something a little more exciting, we have the opportunity to purpose-build a T1 translational facility. It's not just pure research for the sake of research. It's the idea of doing research with the absolute integrated plan of moving those forward so we can help out our patients. So PHCRI, Shauna Turner, Bob Sindlar have developed a process to really help in early commercialization, and we work with UBC, and we can expand on that for IP protection. We already have an iterative development process with CDRD, but I believe we can expand that. A first-in-human facility would be transformational for British Columbia and for Canada, actually, within a hospital setting. And we're setting up a scientific advisory board with the notion that venture philanthropy is maybe the way forward instead of just the old give a gift and walk away. We really want ongoing participation. And what that's done is, I think we'll be able to help Victor out, and I actually think for each of the seniors that you heard about earlier today, we think we can make a difference if we make sure that our basic science discoveries actually help them out. And so I think we have the tools to really get started on a Healthy Aging Institute. Thank you for your attention.